see some people are joining. Welcome, everybody. Thanks for tuning in here today on this great Friday. I know by me today, it's actually, we've had a lot of rain this week. I'm sure some people tuning in have also experienced that. So it's nice to actually see the sun shining and leading us into what hopes to be a great weekend. So I thank everybody for joining us today. We've got an awesome guest today who's going to talk just a lot about what's going on, specifically in the field of peer support and recovery coaching and peer supervision, and the things that have possibly affected that just with service delivery. But before jumping into that, I'm just going to introduce myself quick. My name is Wes Van Epps. I work for Wisconsin Voices for Recovery. I'm also joined here by Geschke, one of my coworkers. So we've been doing this now, for a couple months, and just having great leaders in recovery and individuals in recovery around the state and the country joining us, and just talking and having conversation about what's going on. Some of our past guests have really inspired people that have tuned in and watched live, and we're just really grateful to be able to host something like this and continuing having individuals in the recovery community wanting to join too, and just talk about what's going on with them during this time. So if anyone that's tuning in live, there is a little chat button but down below. You can type in comments, questions down below. You can also raise your hand during this and we can call on you. Feel free to engage as much as you'd like. Any questions that you have on any of the topics that we're talking about today, just feel free to talk. We'll have some time at the end too that'll be specifically dedicated to questions. So with that being said, I'm going to welcome Kris Kelly. So Kris Kelly is joining us today, and you do have I'm going to just kind of give a little intro of Kris, and I hope it's not too long-winded. I know, Kris, looking at your intro here, I know that you've played a huge role in the peer delivery services with the career that you've chosen. But so Kris is actually the Minnesota State Project Manager for the Great Lakes Addiction, Mental Health, and Prevention Technology Transfer Centers, and subject matter expert on peer-based recovery support services. So I've actually had the opportunity to meet Kris and do a couple projects with Kris, and actually took one of your trainings, Kris, back in the fall, based around peer supervision. And I know that you've done a lot of work in this field, and your experience prior to this too, and what's led up to you doing the things you do now. I know a lot of people have been influenced by your work and appreciate the stuff that you've been able to bring to peer support services and just the peer support platform. So welcome, Kris. I'm going to bring you on here, and I'm just going to ask you to give kind of more of an intro to yourself for those that are in the live right now, and for those that are going to be watching this later. So if you just want to tell us a little bit about yourself, Kris, a little background, and kind of your career journey and what led you to doing the line of work that you're doing now.
Sure. Thanks, Wes. Thank you for that introduction. I think you made me sound much more important than I really am. So, so my name's Kris Kelly. I'm a woman in long-term recovery. For me, that means that for the last decade, I've been able to be really present in my life and raise my child, who was 6 when I came into recovery. So she has a mom in recovery. It's allowed me to engage and help her through her life process, bond with my parents and my sibling and be a support system there. Simple things that I think a lot of people take for granted. So early in my recovery, I was able to buy my own car, which was really exciting. And about 4 years ago, I bought my own house, which I never, ever imagined was, I didn't write that in my script even 10 years ago. And then now it's really, my value system is really aligned. So how I live really aligns with my values today. So I do things like I contribute to my community, I pay my taxes, and I vote. And it's really important to me to pay attention to who I'm voting for and why I'm voting, and kind of be more of an advocate in that in that sphere. And so it's a little bit about who I am as a person. Outside of that, let's see. So I currently work, as Wes said, for an organization called the Great Lakes Addiction, Mental Health, and Prevention Technology Transfer Centers, and that's a big name. We're based out of the University of Wisconsin-Madison, and we're a SAMHSA-funded collaborative. So SAMHSA funds us to provide technical assistance. And when I say that, what I mean is technical assistance in the way of resources and trainings to help grow and build the behavioral health care workforce. And so I joined our team in November of 2018, and I was brought on to really bolster our efforts in the area of peer recovery support services. And so I myself came through the door of peer recovery support services in 2013. Prior to that, I had been had a career in the restaurant world. And I always say that meeting the recovery community and people in the recovery community was the first time that I ever felt a pull to do something other than work in restaurants, because I loved working in restaurants. But meeting the recovery community, and I was probably about 4 years into my recovery at that point in time, it was the first time that I was introduced to a space that welcomed multiple pathways to recovery with open arms. I myself had many attempts, like all of us, at recovery, initiating and sustaining a life in recovery prior to 10 years ago. And each time it was like I was offered this really narrow kind of pathway. It was like, here's how you're going to do that. Oftentimes it was because I had been in some legal trouble. So they kind of offered me this sliver of like, here's how you get into recovery. And even then it was more, here's how you get into abstinence. And it just nothing really gelled. It never felt right. It always felt like I was always waiting to return to the life I had. And something in me shifted. I don't know if it was because my daughter was 6, and I knew if I continued on the path that I was on, that I probably wouldn't maintain custody of her. I don't know if it was just because I was so sick and so tired and exhausted and had so many job losses and was just kind of at that point of like, what am I doing? How can I do things differently in my life? And so kind of fast forward 4 years from that initial recovery initiation, and I was working in restaurants, and someone introduced me to the executive director of Minnesota Recovery Connection, which was the most longstanding recovery community organization in Minnesota. And I had coffee with her just to talk about, like, who are you guys? What are you about? And I just fell in love right away. I was like, wow, like, so you help people sustain their recovery. So you are the thing that happens after that acute care, after that treatment that's so short, and I felt was helpful for me, but wasn't the answer. It was like, I kept asking before I met with her, I said, where are my people? Like, there has to be other people like me who are in recovery, but don't necessarily attend mutual aid support groups or any of that. I had really focused on coming into recovery. I'd really focused on like going back to school, being a really good mom, and just engaging with my life again. And so, like I said, I just kept wondering, like, where are my people? Because if I'm here, there has to be other people like me. And so meeting with her and her bringing me into that recovery community was the first time that I met other people like me who were also in recovery, and we all did it differently, and none of it was wrong. The door didn't shut. They didn't say, oh, sorry, you got to go around to the back entrance, or like I wasn't coming into this through the wrong door. And so immediately I signed up to volunteer, and just kept saying every time I'd show up and do some volunteering, like, how can I work here? All I want to do is, I'm passionate about this and I want to work here. And I got hired extremely part-time as a healthcare navigator. So when the Affordable Care Act came out, I helped people enroll for health insurance. And so I got trained as a recovery coach, and I worked in, I actually went out to residential treatment sites and different methadone clinics and enrolled people for health insurance as a recovery coach. And it was through that process that I really learned how people really responded differently when they showed up to enroll for healthcare, and I explained to them I was a person in long-term recovery. Their guard kind of came down, and they said, "Oh, like, thank goodness, because you're not going to judge me because I haven't had a steady job in X amount of years, or here's what my life looks like today, and to other people that looks really messy." But they were able to sit and go through this process and let me help them navigate this really confusing system and share and be honest and transparent with me, because they knew I wasn't going to be judging them. And so that was really my first experience with recovery coaching. And it just really helped me understand from a boots on the ground level, like what recovery coaches do and that connection they make, and how we are so useful and vital in so many places, so many roles outside of that, inside and outside of that traditional clinical treatment system. And so I kept pestering the person who facilitated our Recovery Coach Academy, and telling her how much I wanted her job, basically. So I said, someday I want to be the facilitator of this training and help me meet that goal. And so I really shadowed, and she mentored me for a couple of years. I sat through a lot of different Recovery Coach Academies with her, and then was well prepared when she left her role in 2016 to take over the Recovery Coach training. And then the state of Minnesota happened to up their funding for recovery coach training. So I ended up training hundreds upon hundreds of coaches during my time there, which was just probably one of the biggest joys of my life, was sitting with other people in recovery and really taking that deep dive into, what is this profession all about, and the role we were taking on by becoming recovery coaches, because it was much more than that one-to-one support. It was a new way of thinking. It was about, like I said, kind of taking down barriers and helping people access recovery, and really maintained a strong focus on how do we reach the people who aren't invited into our traditional systems. And so if we kind of go by SAMHSA's guidelines, about 10% of people who might have a substance use disorder get any sort of specialized help. And so that always gets me thinking, well, what's going on with that other 90% of the people? And how can we as recovery coaches get out there in the community and help that 90% get some sort of support, whether or not it was recovery, but because they're humans on this earth, they deserve support if that's what they're looking for. And so through that role, I became a director of programs and built a lot of different programs in some treatment courts. Like I had said earlier, we did some work within some local methadone clinics. I worked with some recovery high schools. We did a mobile substance use disorder program. So again, connecting with a hospital system for any type of substance use disorder crisis. Just started building programs and embedding coaches in different areas. And during that process, I was learning kind of that lived experience of learning how to do that in real time, and then doing a ton of studying and reading and connecting with other advocates around the nation about how their programs were running. And as we hired staff on at Minnesota Recovery Connection, I became a peer supervisor and learned a lot in that role too about how to supervise. I made a lot of mistakes. There's lots of things that I would do differently today, just with the knowledge I have about how I supervise peers and how I set different systems up. And yeah, so that's kind of, I ran that recovery community organization. When I ended my time, I was the co-executive director. And so a lot of different roles within that same organization. And then that's when I moved over to the Great Lakes Addiction Technology Transfer Center. Yeah, so that's a little bit about my path. I say sometimes, like, I feel like I was the poster child for what a recovery community organization can do, because I didn't necessarily have the letters behind my name to move me along, but it was that authentic, the people around me who were also in recovery, supporting me and then bolstering me and lifting me up so that I could access, kind of new achievements in my life. And I feel like that's our role in recovery, is to lift other people up and help them access their own, pathways in life.
No, great. Thank you so much for talking a little bit about yourself, Kris. I know that, one thing that you touched on at the end here was, for yourself, kind of leading into the supervisor role of coaches and peers. And I know recently you've been, that's one big focus too that you've been working on is the trainings around that, and that I've been a part of too. But I think this could be kind of a big question to answer. But I think what I would like to ask is looking at that peer supervision role within an organization, because for me, as much as that role of a recovery coach is so crucial within a community, but also the role of that peer supervisor and supervising those coaches too. With my experience, I've also, it's been a learning thing for me to supervise peers, and stepping into that arena, I've learned things out of it. I've had challenges and but also people along the way to help me with that. So I think the question I want to ask you is how can somebody be an effective peer supervisor? When you think about the role of that peer supervisor with your experience, how can somebody kind of fit that role and support their peers the best way that they can?
Mm-hmm. Good question. What I'll say from what little knowledge I have about it at this point, because I think my journey in this world is going to continue in this area. But from what I've gleaned and learned is, first, obviously, I think the obvious is that they have a thorough understanding of the role themselves. I really advocate that anybody who's going to supervise peers goes through the peer training. I think it's nearly impossible to be an effective supervisor of peer support if you haven't been through recovery coach training. Typically, they're around 40 to 50 hours, that foundational training. And so as an employer, if I was employing somebody who was going to be a peer supervisor, to me, that would be a really, really wise investment, because it just gets them through the principles and the practices of peers, and allows them then to supervise those positions from that way. I think what I found in my own role as a peer supervisor was to, just like when I meet with recovery, if I'm going to meet with somebody as a recovery coach, as a peer supervisor, looking at the people I supervise and saying, this doesn't necessarily need to be a terribly hierarchical relationship. And I looked at my role as a supervisor. Once I felt like really comfortable in it, and I kind of felt like I had gotten things right, I was a coach and supervisor. In other words, I built on people's strengths. I really asked my employees what types of things would they want to be working on, and what were they passionate about, and making sure that I fed them in that way. And gave them opportunities, whether it was outreach or public speaking, or they really wanted to get better with their computer skills, or they really wanted to learn motivational interviewing, that skill set better. I found as a supervisor, if I took the time to create those plans with the peers that I worked with, they showed up in a way where they felt proud and they felt engaged in their work. On the flip side, what didn't work, which sometimes happens when we're a peer supervisor and we're wearing like 10 different hats, And the supervisor is just one of those hats. I tended, when I first started, I tended to kind of make a policy in reaction to things. And so, we kind of created a program and would have some basic policies and procedures. And every time something went wrong or in an unexpected way, I'd create a policy in response to that thing that happened. And so we ended up with this just ridiculously long policy list. And a couple months in, I reflected on it, and I'm like, wow, that wouldn't feel good. If I started here and I got that policy manual, it wouldn't feel good, because it would feel like there were so many rules, I wouldn't even know which ones to follow or how it applied to me or how it applied to my role, and almost would create this kind of sense of fear. And so as a supervisor, we have to be open, and we have to be adaptable, and we have to be mindful and take in that feedback, and then to create a safe space for that feedback to exist. And so, I've worked in different situations where there's, like an open door policy in theory, and people might talk about transparency, or it's okay, bring this to me, but then people bring something and the response is less than favorable. And so people almost feel punished for speaking their minds. So I think as supervisors too, we really have to know ourselves really well. Early in my role as a peer supervisor, I was able to go through a year-long leadership training here in the Twin Cities. And I think that really helped me understand, because it took me back to kind of that stuff I was talking about earlier, like my core values and my passions and things far beyond careers, but really how I wanted to show up in this world. And as I really focused on those things, I found I became a much better supervisor, because it wasn't about right or wrong or following rules, but it was about guiding, and it was about being of service to the peers on my staff, and saying, my goal is to have you live out your dreams. My role as your supervisor is for you to do the best job possible. And so how can I support you in doing that? And when I kind of flipped it versus how I started, very top down, very rule heavy, and I flipped it and turned it into, I want to be of service to you, and I want to support you in being the best coach that you can be, everything shifted in our workplace. And suddenly that transparency was there, and suddenly people felt really comfortable coming to me and talking out things they were struggling with, things that they, a year ago or, a year prior wouldn't have brought to me, because they would have been fearful that, a new policy would be created. And so that was pretty cool, and to me, a transformative shift, and let me know how effective that can be if we really look at picking out what's right, and really calling out what's going well, and framing it in not how can you, what don't you want to do, but what could be better. So it's just kind of, and it's not ignoring the bad things, because, stuff's going to come up and people might make mistakes that need to be addressed, but there's always a way to do it that's helpful, and it retains your best staff. And then the people who aren't there to show up in the way that aligns with the mission of your organization, they don't stay on staff, is what I found too. People who weren't a good fit, they moved on and they got different roles, and it didn't need to be a negative experience for anybody. Did that answer?
Yeah, it did. And it's, just listening to how you were explaining that too, and some of the things earlier, you brought up a couple times the word opportunity, and how opportunities within this field, listening to your story, just how, when we put in the work and we're dedicated to things that we love, how opportunities present themselves in ways that we never thought they would. Mm-hmm. I know that's what's happened in my life, with my life and my career, so going on that, I just love that word opportunity. So I guess the next question is, how can we look at maybe the disruptions of things that are going on with COVID-19, and how can we make an opportunity out of these things that are happening, or the things that have changed, or the differences that are going on, and how we've had to adjust as our role as a peer coach.
Mm-hmm. Yeah, I think so. Kind of, again, go big picture. What happened is for me personally, what I paid attention to and saw was, as COVID, the pandemic really started and became this public knowledge, and we were all kind of going into these shelter in place and stay-at-home orders and that sort of thing. Was I saw a number of really bold responses that came out, like in the New York Times, and definitely like Star Tribune and Pioneer Press, our local newspapers. And kind of the headline was like really fear-inducing about what was going to happen to the recovery community. And as I read the articles, really what it was saying was treatment is going to look different. And we're going to have to transition the way that we have historically provided services. And the content of the article to me was a lot less scary than the headline. And so it kind of perplexed me in a way, meaning it was kind of this doom and gloom headline, and made me feel fearful inside, like, oh my gosh, people are going to have all these reoccurrences, and what's going to happen? And then I would turn and I would forward face the recovery community that I'm a member of and that I take part of. And I was like, wait a second, they're okay. So it's not to say, make light of, or say people haven't been left behind, or that people haven't been able to access services, or any of that. So I don't want to like sugarcoat or silver line this, but what I want to say is what I saw happening was almost revolutionary. What I saw was worldwide a recovery community responding with, more access to recovery supports than I had ever seen. More access in the last decade than I had ever seen. And they were at my fingertips. So they were accessible through my phone and through my computer. I saw many communities figuring out how to socially distance and host meetings. And so it wasn't an end to this, to meetings. I saw communities that said that were leveraging what do people need right now. So some communities continued with their meetings as is, despite shelter in place orders, saying, well, for some people, the risk of getting, COVID-19 versus the risk of losing all those social supports, the risk they were willing to take was the COVID-19 risk. And so, but that's what I saw, was this underbelly of like kind of beauty in the safety net that the recovery community has always provided. But I saw a brighter light on it. And I really started to kind of challenge this notion that it was all doom and gloom, and to look at what piece of the system was actually having the most trouble transitioning. And it was more so that the clinical treatment side, saying how, because they're the ones who had to, do the assessment and provide the direct service and do the billing and all these different components that needed then suddenly to transition. And there's a bit of bureaucracy behind that, and there's paperwork and approvals and all this stuff, where the recovery community is always really nimble, and we're able to respond and kind of do things differently. And so it just really got me thinking about, we need to do a better job telling that story as a recovery community. We need to highlight all these stories of resilience and really look at the recovery community's response to the pandemic. Because again, what I was experiencing in real life, in real time, as a member of the recovery community, were great stories of resilience and change and ability to adapt. Yeah.
Yeah, that's good stuff. And I think too, looking at kind of your story here and your experience with recovery support services, what I would like to maybe ask too, and I know we're getting down to time here, but one other thing too is looking at kind of that transformation and even like, individuals embracing recovery support services since you've been in this line of work. How has that changed over the years of recovery support services in your eyes, and people accepting it more?
Yeah, I think what I saw was a bit, at least here in Minnesota, and I'm kind of familiar with other states. So what I see is kind of the larger medical model more willing to and wanting to bring on peer support, recovery support services, and some even doing that. And usually if the organization or the entity hasn't done the groundwork to prepare for the again, I'll use the word transformation that occurs when you bring peer support staff into your organization, it can go well, or it can kind of go mediocre, or it can go really poorly. And so what that made me think was kind of going back to, there's something called the Philadelphia Toolkit, and it was Dr. Iajima Chara and Arthur Evans wrote this toolkit in the city of Philadelphia about all the steps a system can take to prepare for embedding peers into different services and systems. And for years I've read through that, and I know I've been able to work alongside Dr. Achara, and I was able to meet Dr. Evans, and I kind of geek out anytime I meet those folks and ask a lot, do I have permission to use your toolkit and whatnot? Because I just thought it was the coolest thing ever, because they really created this roadmap for how to integrate and embed peers. And part of that process happens, I would say actually about 80% of the process happens long before a peer ever steps through the doors. And so some of it is an organization thinking about, are we a recovery conducive organization? So do we use recovery friendly language or non-stigmatizing language? Are we ready to, I always say, peers amplify the voice of the people they serve. And that's our job. That's our role as advocates and our role as peer recovery specialists. So if suddenly the voice of the people you serve is at the table in your staff meetings, how is that going to translate? And is everybody going to be comfortable with that? Here in the Twin Cities, I walked an organization through that whole process, a pretty large treatment provider. And even in the end, kind of the chief operating officer and different people were a little taken back when they got their staff's first response to learning more about peer services and how it might alter the way they do things. So they kind of felt they were a slam dunk at first. And then once their staff were going through the training and they saw some people's responses and pushback on some of the things I was talking about, they said, wow, like, we are glad we're doing this work, because it's not as easy as just hiring a peer onto staff. So a lot of the, Wes, which you know, because you took part in the NADAC webinars, but more so now when people ask about peer supervision work, I'm happy to help supervise or help do a training around supervising a group of individuals as peer supervisors. But more so I'm starting to ask, like, let's talk about the organization, because no matter how well you train your peers or how well you train those supervisors, if the organization isn't ready for peer support, doesn't matter how well trained they are. If it's not a recovery conducive environment and it's not ready for some change and transformation, those roles aren't going to be successful. So how do we do that pre-work? Do some assessments and really get to know kind of the state of the organization and how it talks about recovery, and how does it include the recovery process? Does everyone really sign on to recovery is the expectation for every single person we serve? I mean, if that's not just a given within an organization, it's going to be hard to have things like peer support work and thrive.
Yes, thanks for touching on that too. I know that was one thing that was on my mind is making sure to even just talk about, organizations as a whole, and looking at how they can even support their supervisors. Because I think you bring up a great point. I know that there's many organizations that are peer-ran organizations that know, exactly how it is to be a peer, how it is to be in recovery, and I've seen those organizations really take off and be super effective in their communities. I'm not saying that organizations that aren't ran by peers can't do the same thing, because I've also seen that too. But it's that understanding of what that role means, and how they can support their supervisors, and really give back to their community in that way. So I appreciate you bringing that point up.
And on the flip side, I wouldn't expect a clinician necessarily to thrive working at a recovery community organization, right? So it kind of goes both ways, because like typically a recovery community organization isn't set up for clinical services, and we don't always have a billing system up and going, and we just do things differently because we're this grassroots nonprofit organization that has many different goals within it. And so it works both ways. And so just like if you were a grassroots RCO, I wouldn't expect a clinician to come in and thrive, because the culture is different. The language we use is different. The way the business is run is different. And so we should think about it the flip way too. But sometimes I get some people that almost are offended when I say that, like, oh, not every organization is ready for peer support. Some organizations take offense to that. Like, well, why, we're recovery friendly, and it's not a accusation, but it's just like preparation, like we would for bringing on any new role.
Yeah. And I know there's a few people in here, just open it up. If there's anyone that has any comments or questions for Kris, I appreciate you coming on here, Kris. You've had lots of good things to say. I always enjoy talking with you, even, not in this setting, just about stuff in this field. So yeah. I always take away some good things when I have conversation with you. So I just want to open this up for other people that are on here, if you have any questions, before I ask my last question for the day.
Hello, I would really like to know, oh, sorry, I'm late also. I would really like to know how you got the high schools engaged in the recovery community. We've been kind of working on something like that, doing maybe a presentation during the school year. Of course, not now because of COVID, but school will start eventually, I'm assuming. I just want to know whether schools or high schools are already recovery schools, or did you present them with this idea to educate the kids about substance use disorder and recovery resources?
Thanks. That's a good question. I'll answer it twofold. So so I sit on the board of a recovery high school. And so that's where I did a lot of my kind of support and work, and train some coaches. So they're forming a alternative peer group. So if you haven't seen the film Generation Found, that's a great place to learn about alternative peer groups. And those are essentially like recreational kind of after school programming for kids in high school that struggle with substance use disorders or are in recovery. And it's a great model. And so we're starting an alternative peer group here in the Twin Cities with one of our recovery high schools. So there wasn't a lot of work in opening that door, but where I've had success with other schools is offering support around National Drug Facts Week. So that's a great week to approach schools. And I think we just ended one here. But it's a great week to approach schools and offer to support them in their National Drug Facts Week, even finding out, do they do anything for it? Because a lot of schools nationwide offer some type of programming. And what's cool is when the recovery community engages in that, we come in and we tell our recovery stories. And a lot of times what they're used to hearing are the addiction stories. And so they're used to hearing the war story and kind of the hoopla. And when we can come in and share our recovery stories, I think that really shifts a perspective for a lot of students that, look, people in recovery have fun and they have these great lives. And, you know, we know statistically speaking, kind of the sharing of the addiction story isn't impactful. But we know statistically speaking that sharing our recovery stories is what plants those seeds, that hope. So I think there's a lot to do, but if you're interested in that work, I really recommend that Generation Found. And then Wes, you might know someone else that was in the anonymous people. He was a basketball player, like The First Day, I think is the name.
Chris Herron.
Yes, Chris Herron just created a film. I think it's called The First Day. Is that right? Do you think, Jessica?
Yes, that's right.
Yeah, so that's another great film to watch that kind of covers that area of addressing kids in high school.
Thank you very much.
Yeah, and I'm sure a lot of like the health teachers and whatnot, even if you just kind of did an email to local high schools of their health teachers, they have to cover the subject, and they're open to, you know, having community members come in and talk about their recovery journey.
Yeah, and what I've seen too is actually before this COVID stuff happened is there was a local school here that they created like a leadership like help group for students that were kind of the leaders in the school, addressing, you know, issues and you know, kind of empowering their fellow students. And I was asked to come and speak to that group of kids before COVID. I never did because the school shut down, but look into that too. You know, I know a lot of schools now are creating groups like that where they have teachers that are kind of leading the group, but also having a core group of kids that are just empowering their classmates and speaking up and you know, sharing messages of hope like that. So that's what I would maybe try to tap into as well, Aaron.
Thank you.
You're welcome.
Anybody else? I know we've had a few thank yous here, Kris. A couple of people commenting, just thanks for what you brought today. I guess the last question I have for you, Kris, is there anything in the future here that you may be a part of, any trainings coming up that are virtual that we could be connected with?
What I would look out for is we actually are going to do through the Great Lakes Addiction Technology Transfer Center. So you can go to the Great Lakes-ATTC website to sign up to receive announcements about trainings and webinars and different things we have to offer. Some things, exciting things I'm excited for is we're actually going to do a series called Inspire and Think Big. And it's lessons from the recovery community, all about what I talked about earlier. So different communities across the US that are going to tell us about their innovative responses to COVID-19 and challenging times in general. So that'll be a really fun project and a way it's like 6 different interviews that we'll be rolling out. Always check the ATTC site for any support you want around motivational interviewing. So I have a colleague, Laura Saunders, and her and I do a lot of work around that. So there's different recordings, free and accessible, on motivational interviewing through the Great Lakes-ATTC website. And then we're also doing, we're not quite sure what it'll become, but we've done some work on resiliency and recovery as well with individuals from around the US. And we don't know yet if it'll be a panel or a paper, but something will be coming out around that. Other than that, just know too that you can reach out to me or Laura Saunders or really anybody at the Great Lakes-ATTC, because I'm assuming most viewers might be from Wisconsin, but we serve the Great Lakes region. You know, if you work for an organization and you're looking for support and some sort of training, we're a great place to reach out to and say, you know, Kris, we'd really like a training on motivational interviewing for peer support, or like I did a whole health action management training for a group, or I did a peer supervision training for a group. And those trainings are available at no cost to the people requesting them. So it's a great resource for bolstering your peer support services. Just a good opportunity, because I find a lot of our larger system knows how to connect into the ATTC, but I think our peer workforce hasn't really known about that and been included in that. So that's kind of my role, is to ensure that peers know they can access all sorts of trainings. We'll develop things if they don't already exist too. Wes and I have had lots of conversations around that. What's needed and what can we develop and help grow our workforce.
Great. Well, thank you, Kris. I'm always excited to see what's coming next from you guys over there. So I appreciate you coming on here and, you know, spending this afternoon with us and just chatting. And I'm sure a lot of people are going to be watching this later too that weren't able to join. So I appreciate it. It looks like we're having somebody in the chat here. Can you put that resource in the chat if you want to as well, Kris? You know, I'm pretty familiar with the resources, but I could also put this on the link to our Facebook, some of those resources and websites and stuff.
Yeah, I'll just do I just pulled up the Great Lakes-ATTC, so I'll throw the website in the chat if she wants that right away.
Okay, yeah, if you could do that quick, that'd be
and
great.
Then that way too, you'll be able to see on there each state has a state project manager, and you can reach out to any one of us. So there you go. There's the link there.
Great. Thanks, Kris.
All right. Thank you.
And thank you everybody for tuning in again today. Be on the lookout. We got some more guests coming up here in the future. So I hope everybody has a safe and wonderful weekend, and we'll talk to everybody later.
All right. Thanks all. I appreciate it.
Bye, Kris.
Have a good weekend.
Have a good day.